We're here today talking with Dr. Tom Lewis of Real Health 120. He is the Chief Science Officer. Good morning, Dr. Tom.
How are you, Steve?
I'm good, thank you. So what is primarily the vision of Real Health 120? What do you see it as?
Right. The true vision is to facilitate people being healthy from birth to death, whatever God prescribes their end of time, but during that period of time to be as healthy as possible.
And how do you address that?
How do we address that? We address that early and often. So the whole thesis is advanced, what we call a differential diagnosis, to assess people before they have disease. Right now we act in a very reactive way in medicine. Our whole approach is to be very proactive, to do testing while people are asymptomatic. In other words, they don't have symptoms of disease, particularly chronic disease, but that disease is in their body. It's there, but there's enough redundancies in the body that it doesn't express clinically. But we can see it. We can determine it.
So you're talking preventive.
Preventive, maintenance, but also because we've developed a real profound understanding for the mechanism of a lot of these chronic diseases, and we see a great overlap, and even people, say, in diabetes, in Alzheimer's, with multiple cardiovascular events, these people can be treated and have their quality of life improved as well.
So you are treating people with disease
Absolutely.
Right now?
Absolutely. And so our mantra is diagnose, diagnose, diagnose. And when you have a thorough and complete diagnosis, then treatment reveals itself. It becomes almost obvious.
Tell us a little bit about Real Health 120.
Well, Real Health 120, first of all, we're talking about real health, figuring out how to make yourself healthy pretty much on your own, and then 120, which is an interesting topic. National Geographic magazine just came out with a feature article in their May 2013 magazine that had a picture of a baby on the front cover. It said, "This baby will live to 120."